Again, another way is just engaging people in pleasant activities. And I can't tell you, people who are depressed believe that they won't enjoy anything. It's part of the depression is this pervasive negative mood and predicting ill for the future. So people don't believe that they will enjoy anything, or oftentimes you see people get depressed after a loss. So we've had people become very depressed after losing their job because all of their social network was really around their job. So now they're suddenly isolated and alone. Or a life partner dies and they did everything together and now they're staying home and doing nothing pleasant. So those people need to learn. We try to help people learn to increase pleasant activities. And you have to feel that you're worth it to give yourself pleasure in life. So that, it's an important part of this is telling people, I think you deserve a nice bubble bath tonight with the door closed, your kids outside, and an hour to yourself to relax. Those sorts of things to allow people to do pleasant things for themselves. We also treat people's mood by helping them with their interactions with other people. Certainly negative thinking can interact, as we've talked, with having good interactions. People need to oftentimes build up their social network. Again, maybe they've had all of their interactions has been as a couple and now suddenly they're single, and so they have to relearn that. We work on assertiveness with people. Part of being, many people come in, I'm going to dichotomize people, and it's more complex than this, but one group of people you see often with depression is totally isolated people. The other group is the people who are around people all the time, but people who take advantage of them. They haven't learned to be assertive. So the grandmother whose children are dumping their kids on them at, all hours of the day and night, and they feel overburdened by that, for example. So we really help people learn to be assertive and speak for their own needs, and maybe be assertive with a spouse who isn't as thoughtful with them as they should be. And we try to improve problem-solving behavior. So we have this great cartoon in our manual that shows people pointing at each other, saying, the problem is you, and then the next one, the true one, the problem is out there. We have to solve. It's not you, it's not me. The problem is in between us and how we're interacting, and that's what we need to work on. So really helping people with problem-solving skills. And again, helping people learn to build trust slowly. Those people who come in and tell you their heart was broken by somebody they couldn't trust, often they got in that relationship really quickly. And didn't know the person well enough and then get hurt. So we advise things, if you want to get to know somebody, the first time, meet them in a public place. You have your own transportation, you have your own way home, and so all you have to do is show up and you can chat. Your ability to be happy is not dependent on them. If they don't show up, you went in, you had your cup of coffee, you went home. If they do, that's fine. Then the next time, maybe if they're really nice and seem more trustworthy, you might want to go in the same car and, slowly build trust, not just jumping into relationships. Those skills can be extremely helpful to people. So just to give you an idea, we have a manual, and I know there's, do people here hate the thought of a manual? Anyone here want to say they just don't like the idea of being told what to do? You don't like the thought of a manual?
I've always had a difficult time transitioning from, say, a model that's not evidence-based with wraparound. I use a lot of CBT, but transitioning to a model like CBT that is evidence-based, and there's stages of treatment and different phases. It's difficult for me. There's a booklet and there's a 2-day training, and it's very difficult.
It feels different at first to use a manual, and you do have to work with it for a while and make it your own, because you can't, we have a manual that helps you, but you have to use all your clinical skills. So we don't want you to throw those away at all and kind of make it your own. The great thing about a manual is it gets you to do all the things. It's so easy to go in and have the patient tell you how bad they feel, and you hear the story of the week, and you empathize and give some suggestions, and then they're back the same place. This makes you build the skills that the patient needs. And So, I think it is hard, though, at first. You kind of have to do it a few times before I think it becomes a really natural thing. But once you do, it really helps you remember all the things that you need to do and get you, to do a really effective treatment. So we often, I like to use group treatment largely with low-income patients. One of the reasons that I like to do group treatment is I remember I had a very depressed patient in my office. I was seeing him alone, and he said to me, "Well, Dr. Miranda, what do you know about my depression? Give me the keys to your car and your house, and I wouldn't be depressed either. And and your salary." And I was pretty stuck there, right? I mean, I did not live like this man who had a harder row to hoe than I did in life. So it's really tough. In groups, we have a group of people all who, come oftentimes from a similar socioeconomic status, and you see people getting better and they support each other. It's really great. So I love group therapy, and it's a very effective way to do groups. I think one of the things that groups we did, I don't know what the people got a lot from each other too. They really learned from each other and cared about each other and get a lot of social support in the group. So I love to do groups. We always start them with giving them some rules about being confidential and coming on time and talking with us. We do introductions, and the first thing I like to do with a depression group is to talk about what is depression. Again, many people sort of don't know exactly what it is and don't think of it as a disorder that they can get treated. I don't know that you even have to think of it, but as something that we could treat and make them better. And it's a good way to get people in a group to bond. So we say, what's depression like for you? And we write all their symptoms on the board, and then we say that, you're all here, you share that. Everyone in this room is different in many ways, but you share depression. And we're here to fight that, to get everyone over depression. And it's a great way for people to form a bond. Then a really nice thing about CBT is you are really honest with people. You tell them exactly what you're doing. It's very open. You tell them about, that this is what we're going to try to do. We're going to try to work with the way you think about things, the way you're spending your time, and the way you're interacting with others. We have 4 modules that focus on thinking and how it affects mood, and that's the beginning. And we have some great drawings. We now have in Spanish a manual that has minimal words for people who don't read and write so well. So we're really trying to move down for folks who have trouble with language. But we have these examples, like the guy comes out, it's raining, he's very unhappy about it. The next guy comes out, same situation, it's raining. Thinks, "Ooh, this is going to feel good. It's been hot. I'm going to run around and cool myself off." So it's the same situation, but the way they're thinking about it is really affecting their mood. So we give that as an example. We get people to write down their thoughts, to start paying attention to them and write them down. We ask them to remember the time they felt the worst in the last week and write down their thoughts, and then we ask how it makes them feel, and we ask them, is it accurate? Is it complete? Is it balanced? And oftentimes we find those thoughts that are plaguing people and hurting them so much are not accurate, they're not complete, or they're not balanced. That there's some way, in which they're not. If they examine it, oftentimes even when you get them just to write it down, they'll look at it and say, I don't really believe that, but it's sort of been once in the back of my mind, this very negative thought.